Welcome to the Fix SLP Summer School Series, where we're schooling the system all summer long. If you're ready to challenge the status quo in speech-language pathology, you're in the right place. Subscribe so you don't miss an episode, and if something fires you up, leave us a message on the Minivan Meltdown line at fixslp.com. Grab your favorite summer beverage, and let's get to work. Hey everybody, welcome back. It's Jeanette. We are coming close to the end of summer school. Summer's not done yet. A lot of us are back to work if we had the summer off, but we're still going hard for summer. Today we have Katie Brown from NeuroSpeech Solutions. We will get with her in a minute. Preston was just given the week off because there were too many women up in this podcast today. So we didn't need all those voices because right now I have Michaela Trainer. Michaela is our Director of Advancement and Partnerships here at Fix SLP. She's been working her little buns off to get our team just a little bit of money. So, Michaela, you connected with a medical supply company, Befitting You. They are sponsoring this episode today. And I asked you to come on. They are an AAC device company, amongst other things. They are exclusive to Michigan, but this is applicable to any state touching Michigan. Like if you live in Ohio or Illinois and you practice in Michigan, you can still use them to get devices for your patients in Michigan. So, Michaela, because you are a practicing SLP across the lifespan in Michigan, I asked you to come on just to give us a really brief overview about who they are, and then we'll hop over to Katie.
Befitting You is the AAC device company that I use. And what I really like about Befitting You is they have this small town family-like feel to them where you're connecting with people. I know the representatives. I have their numbers. I text them. I email them. And they just save me so much work as far as evaluations go and repairs. They come directly out to me and they'll go to wherever my clients are to fix their device and to provide education. And I think that that is so important because so many of my clients are eventually going to leave me, but it doesn't mean that they're not still going to need support with their AAC device. And Befitting You genuinely cares. They go above and beyond, and they have helped me so many times in tough situations.
And they don't require the CCC, do they?
They do not.
Good for them. We love a company that's modernizing. So much work was done in Michigan in the last year. They dropped the CCC requirement for Medicaid right at the end of last year, 2024. And Befitting You Medical Supply got right on top of it and changed their policies. If you all want to check them out, you can go to befittingyoumedsupply.com. Find out who you can connect with for an AAC eval. So thanks, guys, over at Befitting You for sponsoring today. We really appreciate you. I'm going to head over now. Michaela, thanks for jumping in. I'm just going to jump over to Katie now, and Katie and I are going to talk about all things telehealth today. Katie, thank you for joining us again. I should say again, everybody, I call myself out. I'm living a life of stress right now. Sent Katie a link a couple days ago. I said, I'll see you in 90 minutes and then didn't show up. So Katie, thank you for showing up twice and being so kind and patient with me.
Of course.
I'm excited to have you because we have collaborated before. I don't know how long ago that was because I live my life by the hour, but we collaborated on a telehealth post because you are passionate about telehealth and you were doing some advocacy. And we always say like, hey, if you guys are doing advocacy and want to come beside us, let us know. And you did that. And I didn't jump at the chance. Of course, I looked at your stuff first and was like, yeah, this is great. Let's put it out there. So we collaborated. Mm-hmm. And now we're finding ourselves in the same telehealth position we were in, I think, when we collaborated before. So we're going to do another collab this week. But first, before we get to that, tell us who you are and what you do. And I will preface by saying Katie works mostly with adults. But there are pediatric implications here as well. So don't tune out. This applies to everybody and everyone should take action. So, all right, Katie, who are you? What do you do? Tell us all the things.
I'm Katie Brown. I'm a speech pathologist based in Buffalo, New York, and I own a private practice called Neuro Speech Solutions. And at my practice, we specialize in adult neurogenic communication, cognitive swallowing disorders. And having started Neuro Speech Solutions back in 2019, I've really been able to see the evolution of Medicare and telehealth from both sides and what it looked like pre-pandemic, during pandemic, and post-pandemic. Things opened up during the public health emergency, and we were able to see individuals through telehealth. And now we have extensions and uncertainty, and we're essentially just like waiting for the rug to be pulled out from under us. But I think I can speak for myself, and I'm sure many others, when I say that my patients and many other individuals across the country, telehealth has really just been the key to actually getting care, which is why I'm passionate about making sure that Medicare keeps telehealth going for SLPs.
And as someone who is, we just pre recording, I was telling you about all of my family's ailments and how I am the sole care partner right now of two people who cannot and should not be driving. One who is elderly and one in his late 30s. Telehealth really has been a godsend for us. We need this. Living the life now of someone who is on Medicare and someone who is not, we need this service. We need it. It cannot go, I can't do it. I can't fix SLP and not have telehealth for my two people that can't drive.
Right? Think about how many hours that not just the individuals with Medicare, but also care partners, everyone just spend in the car going to and from clinics, waiting in the waiting room for the doctor, just being essentially held captive for things. And I would say that's like one of the least concerns of why we need Medicare telehealth. It's a huge one, but also just in general, people who physically can't even get to doctor's appointments, right? Because there are plenty of people who physically cannot get to doctor's appointments. And if SLPs are removed as telehealth providers, that's it.
Yeah.
We're losing access to care. You would have to pay privately for those services, which is just unrealistic, really, for many, many people.
It's a problem. We're preaching to the choir right now. Our healthcare system is in shambles. If we can do our part as Katie and the Fix SLP team and this platform we have to reach people, we're going to do it because it's one of the reasons why I started this platform. It's why we're here. So what have you done? Because I was really impressed when you reached out to me whenever that was before, and I was like, wow, she's really good. I'm probably going to have to get her on the team eventually. There's a plan here always. You know that, right?
Yeah, there we go. Things working behind the
But yeah,
scenes.
yeah, people who are doing things end up working for monopoly dollars that fixes. So what have you done? Tell us about what you did.
So, I mean, I think the thing is, I do help mentor other SLPs as well, people who are going into private practice. A lot of people are worried about going into adult focused private practices. And I feel like there's definitely fewer adult focused private practices than pediatric in general. And Medicare is generally like the really scary piece of it, right? Because we can't opt out of Medicare. We have to accept Medicare and we have to bill Medicare for Medicare covered services. So, with my practice being adult focused, the vast majority of my patients are Medicare aged who either have traditional Medicare or Medicare Advantage. We've been going through this like timeline, right? Where we were given essentially, we were given a waiver to treat individuals by telehealth because of the pandemic, where before the only healthcare professionals that could were physicians and anyone who's working directly under a physician, so a PA or an NP. And even then, there were some pretty stringent restrictions. There were like geographic and site limitations prior to that pandemic, but then it really just kind of opened up this whole new world. April of 2020, that's when legislation was enacted that allowed essentially everyone to bill Medicare for telehealth services. And I have seen some truly amazing improvements in my patients who were solely telehealth, where people say like, oh, telehealth is not equal to in person. And sure, that could be the case for some patients, but that shouldn't be a blanket statement. I have done swallowing treatment with people by telehealth, and I'm amazed at what they can do.
I'm glad you brought that up because it was something that I was going to pop on you and forgot to tell you I wanted to bring up was the pushback that we sometimes see, especially from our own colleagues, about the limitations there. And I have been of the mindset that if someone doesn't have access, it is better than no care at all. And I had to do a mindset shift there because since the pandemic, I became a telehealth provider for a nursing home in the Upper Peninsula of Michigan, a company that my main company that I have been PRNing for over a decade owned. They recently sold, so I'm not doing it anymore. But they owned a nursing home up there in the Upper Peninsula, and I most of their buildings are in Ohio, and they have a couple in Pennsylvania. And they could not find coverage for that building. So they had gone months without an SLP. And my regional manager lives behind me, and that was included in his region. And he said, Jeanette, if I can work it out where either we're traveling together or we're going up there, could you give some coverage? Would you take a few days? You just heard me give all my care partner woes. I'm doing the, it's like a 7, 8+ hour drive doing all those calculations. And I'm like, you couldn't pay me enough. You have to pay for Mary Poppins and a cook and like all the things. So I just said, what I proposed was, well, how about you just get me licensed in Michigan? If the company pays for me to get licensed in Michigan, I'll do telehealth. And then it would be cheaper for you to pay an aide or an assistant or something to help the person with a device in front of them. If they don't have the cognitive capacity to do that, it will be cheaper for the company to do that than pay to send me up to the UP once a month to give 3 days of treatment or whatever. And they loved it. And so now here I am going into this situation as an SLP, kind of with the mindset that like dysphagia treatment should never be done. Coming out of the pandemic, I don't know if I'm a believer in this yet, but then as we did it, and there was someone standing by sometimes, not always, we made it work. And I became a believer that yes, exactly what you said. Not always is it appropriate, but in this particular instance, this building hadn't had speech therapy in months. They were backed up with a line a mile long of people who needed looked at, and I was literally the only person who could give them any care at all. And that's when I was like, yeah, I'm hard in on this telehealth. We have to keep this going. And then as providers, be ethical, right? Like if nursing homes are asking us to do this across town because they don't want to pay us the travel and mileage to get to the building on the other side of town or the building an hour away, and we know that there are people there who would be better served in person, then the answer is no. It's going to be on us ethically to push back when people are trying to abuse it. But there are a lot of situations where it's the only option, literally the only option. So off my soapbox there, but having gone through it as a provider.
I'll hop back on the soapbox, honestly, because I live in New York State. And when people think of New York State who aren't from New York State, they think of New York City. New York State is huge. I live in Buffalo, New York. It takes me 8 hours to drive to New York City. And most of that drive is rural. I mean, rural. There's not much. So in my clinic, we get calls all the time from people hours away from us that say, I got therapy by the one SLP in my area. The one SLP in my area does EI or is the school SLP that sees people afterwards. And, I was discharged and I think I can do more. And we go, okay, great. Let's try telehealth. And it's just like expanding that access, especially in areas where people are not able to get specialized care in their area. It's a no-brainer in my mind.
Yeah.
And, I think also keep in mind here that although when we think about Medicare, we think about older adults, but Medicare isn't just for older adults. Many younger people qualify too, adults, even children, anyone who is living with a long-term disability with chronic illnesses. Telehealth can be so beneficial for them, and they can actually have Medicare too. I have someone in my clinic right now who's 22 years old. He had a traumatic brain injury at 19 years old from a car accident. He is currently on Medicare because he was on long-term disability for 24 months. And that is essentially the period that you need to wait in order to be eligible for Medicare. So there are plenty of people who are under 65 who rely on Medicare as well. And if this telehealth is taken away, it's going to clog up everything. At this point, telehealth has become a way of life. I use telehealth myself. I was talking to Jeanette before this. I worry about a snowball effect of Medicare says, okay, no more telehealth. And then Medicare Advantage plans say, okay, we're also not going to do telehealth. And then the commercial side of those plans say, we're not going to do telehealth either. And then Medicaid says, okay, no more telehealth. Everyone else is doing it. So that's it. Everyone just needs to go in person or pay privately for telehealth services, which is not realistic for so many people.
I wanted to frame this up earlier because some of our listeners, especially our school SLPs and our pediatric SLPs, might not fully understand this. And you brushed over it, you said it, but they might not fully understand. One of the reasons that reimbursement and compensation in adult care continues to be a problem is that Medicare is a federal regulation that if you are providing a healthcare service to someone who is Medicare age, Medicare eligible, or has Medicare, they don't even have to have Medicare. They could be 70 years old and never opted in. And technically, per this regulation, it still covers them. A healthcare provider is not allowed to accept cash for a Medicare eligible service from someone who is Medicare eligible. And so, what that means is if Grandma Betty needs SLP services at the age of 81 because she's bedbound, and there is no home health SLP in the area, technically she's Medicare age, Medicare eligible, probably has Medicare, even though there's not a provider. I, as Jeanette, can't drive to her house and charge them privately. And so that's a problem. We can't opt out. Currently, doctors are the only ones who are allowed to opt out, and it's all or nothing. They have to choose to opt out for everyone or stay in for everyone. They can't double dip. That's the problem here, is that legally we can't do it. So if telehealth goes away, it's no longer a Medicare eligible service, which means we could take cash for it. However, now it becomes a privilege thing. Some of the people who need us most in lower socioeconomic statuses and communities won't be able to pay privately for these services. So everybody needs to have access, not just the people who have the money to pay for it. Everybody deserves the right to access telehealth services regardless of age, gender, socioeconomic status. Period. I'm going to die on that hill.
Absolutely. I'm in 100% agreement with you. A lot of people will say telehealth is a luxury. We all did it before. Well, no, think about people who can't safely drive. Do we really want them trying to drive? Because that's when people make risky decisions. They say, well, I need this, so I'm just going to drive around the block.
Okay, so what did you do? We've got these issues. Now, what did you create? Because it's really good. What did we have before that we're going to do again? What did you do?
So I'm actually expanding it this time. But essentially, what I have is several different letters and templates that we can immediately send out to our representatives, to our senators, to our House representatives, to let them know that speech pathologists need to continue to be able to access telehealth services through Medicare. So I developed some letter templates. Depends on your amount of time that you are able to commit right now. Maybe Jeanette only has 5 minutes right now to be able to commit to something. So she can use the pre-made letter and send it to her Congress representative. I'll have pre-made ones, and I will also have some that are more templated where you can insert things relevant to you in order to make them a little bit more personalized. So I have that. I also have a letter that you can use to inform any of your patients about what is happening, because I think it's important that they know that their telehealth access might be revoked at this point. I also developed a template for patients to write to their representatives, right? It's not just the healthcare workers who are being impacted, it is also the patients who are receiving telehealth care. And if we want to talk about what do I want to do with in therapy Monday morning, you could do this letter with your patient.
Yes.
And have them send it out, right? And then also different ways that you can format things for email versus sending a letter, as well as teaching you how to find the correct people to send it to.
With the CMS crisis, with the new grads, where we put out resources to send a letter to Dr. Oz to reverse the decision, somebody had set out the cutest little table in their office with pre-made envelopes and stamps with the letters for their patients or their patients' loved ones to send, and then like a little box. So she took care of getting them into the mail and set it all up. So if you have a brick and mortar practice, it doesn't even have to be an adult practice, because remember, if you have a pediatric practice, people like me are bringing their kids in who are also dealing with mom and dad and aunt behind the scenes, that they too probably could care about this. So she made it very easy. And I wish I could remember who it was, because I would give her those props right now. I would call out her name and her business, but she just made it so easy for them with just a little station at the front. So anybody with a brick and mortar location can do that tomorrow.
Yeah. So right now, access is going to end September 30th, 2025. That is our last day we are allowed to bill Medicare for SLP services, if Congress doesn't do something about it, which is why I developed these letters and these templates to send to our representatives in Congress, because right now they are at the helm and they have the power to be able to do one of two things. First would be to do another short-term extension, which is not the end goal. I would tell you right now, that's the most likely scenario that's going to happen right now. I am ready to personally commit the time to start trying to advocate for permanent access. There is currently a law that was introduced, HR 1614. It's called the Expanded Telehealth Access Act, which specifically lists speech, PT, OT, and audiologists as becoming permanent telehealth providers. And then they wouldn't be able to say you can't bill for Medicare.
So Katie has put together an actual website. Katie, I just told you I was going to say it. Why don't you say it? Tell us what it is.
So it's medicareforslps.com/telehealth advocacy. And that's where you can download all of the free resources. You can learn a little bit more about what's going on. And you can also find your politicians that you need to send your letters and emails to.
It's nicely done, well set up. That's a lot to remember. So what we're going to do, as always, is we're going to link this up at the top of fixslp.com. We have 4 colored bars there that I'm constantly rotating in and out depending on what's going on. For now, that's your go-to spot. So you will go to fixslp.com, click the link at the top, and it'll take you right to the site. Thank you for doing this. Thank you for being the voice of the independent, autonomous clinician that isn't relying on a big membership association or other group to do the thing. You know this is a problem and you took it on yourself and you are doing the thing, and that is awesome. So you guys, if there's a thing that needs addressed, be a Katie. Go do it. Let us know and we will come beside you and get it out there and help you out as much as we can, because this is what it's about. It's us taking our profession back. And this helps us bill, make more money, reach more people. And it also helps the people who need us increase the access to us. So everybody wins if we keep telehealth going. So thank you for being the person.
Of course, it's definitely a win-win. And thank you so much for having me on your podcast and also for helping to distribute these materials to people, because I know that you have a much wider reach than I do, and just very happy that people will be able to use these and we can make a difference.
Tell us again where people can find you online.
You can find me on Instagram. My handle is @neurospeechsolutions. I go in waves of being active on there, but it depends on how busy I am in real life. But all of that will be posted there.
So Katie's has a Medicare for SLPs course. So she's going to set up a promo code for you guys. If you're interested in learning more about billing Medicare or getting into the adult space as a private practitioner, her course is one that you could take. I think it is very appropriately priced because she's going to give you $100 off if you use her promo code, and we'll get a little piece of that too to help support us at Fix SLP. I just told her you're probably not charging enough giving all this money away, but that's a conversation for another day, because we do still, as educators, still need to make money, right? The code is Fix SLP. You will get $100 off the course. It is 6 hours, Katie, of PDH.
Yeah, of PDH.
So last fall, we did a whole series on continuing education. She is not an ASHA CE provider, but you can use her course for professional development if your state, or even ASHA, because ASHA does not require ASHA-approved CEUs. You can still use those just if you're tracking yourself or using the free account at Speech Therapy PD. You just get the certificate. That's 6 hours of continuing education that you can use for your cycle, unless, of course, your state requires something a little different. So you will still go to her website, which we will have linked up in the show notes. Katie, thanks for doing that.
Yeah, of course.
Before we go, I just want to thank Befitting You Medical Supply for sponsoring this episode. Michaela talked about it at the top, but go check them out for your AAC devices if your patient is in Michigan. We didn't say this at the top, but we're talking teletherapy. You might live in California, but if you're giving teletherapy services in Michigan, you can access them for AAC devices. And being that they are right in Michigan and so hands-on with their clients and patients using their devices, it actually might be a godsend, because they'll get in there with your patient and help them troubleshoot and do all the things. So Befitting You, thank you so much. Everybody go check them out. We'll see you next week. Thanks for fixing it. Thanks for listening to the Fix SLP podcast. If this episode helped you feel more informed or empowered, take a second to leave a 5-star rating and review. It helps more SLPs find us. Fix SLP runs on $5 sustaining partnership donations. That small monthly support pays for everything behind the scenes, including our website, legal fees, and advocacy work. Want to be a part of it? Join us at fixslp.com. Enjoy the sunshine, stay scrappy, and we'll see you next time.